Hey, I'm Dr. Jenny Jorgensen from Frontier Pediatrics, and this is...
I'm Dr. Josh Jenkins with Smiles for Kids, Idaho.
And we're here to talk about dental emergencies. When the question was like, you get called from a mom whose child fell down and their permanent tooth came out.
Yep.
What do you tell them to do?
Yeah.
I remember from training was the directions we were supposed to give families was to have them put it in a glass of milk and call the dentist.
Yes. Yeah.
Yeah.
So true dental emergencies are rare.
Okay.
Having your permanent tooth knocked completely out would be a dental emergency, right? Maybe having a permanent tooth that is traumatized to the point where it's kind of hanging back or hanging forward.
Yep.
Dental emergency.
Okay.
Almost everything else can wait. It doesn't change what happens with that tooth, right? So the tooth that is knocked out, it's a timing thing. It's a timing issue. We want to get that tooth reimplanted within 30 minutes if at all possible.
Oh, wow.
That's
that is
very
an emergency.
fast. That's an
fast.
emergency,
Yes.
right?
Okay.
So best case scenario, if a tooth gets knocked all the way out, if it's in the dirt, maybe rinse it off really quick with water and try and put it back in.
Oh.
Most parents will be very
Okay.
hesitant to do that because timing is a little bit of a factor in prognosis for that tooth, what happens with that tooth. If they're not comfortable doing that, and that is totally fine, I get it.
Yeah.
Putting it in milk and calling your dentist and just trying to get in as quick as you
As
can
quick
is
as
fine.
possible.
Once you're past the 30-minute window,
Probably.
you can still put it back, but whether we put that tooth back in at 1 hour or whether we put that tooth back in at 48 hours, the prognosis is essentially the same.
Oh.
So if it's been out of the mouth for 2 hours, you're kind of past the point of, you probably don't need to go into your dentist at 2 a.m., for example. You can say, okay, we probably need to get in the morning and get that fixed.
Because if it's gonna live, it's gonna live, and if it's not gonna live, it's not gonna live.
You got
and
it.
Once you're past that hour window,
everything kind of shrinks
everything
as far
gets
as what
kind of
happens
not
to
so
it.
good.
You got it. Yeah, a little bit.
Yeah.
It is.
So,
and that's frustrating,
yeah.
right? But yeah, it's pretty rare to get a tooth back in the mouth at 30 minutes, unless I am at the baseball game when it got knocked out.
And you're like, I can do it.
Oh, I can do that.
Or that parent, they're
It's
like,
hard.
I'm gonna do it, right?
Right.
Yeah.
And we've had a few do
Yeah.
that. I did hear a funny story in residency of
Yeah.
somebody putting in it upside down. So you want to make sure the root goes first.
So you were saying, so obviously if it comes out, and then if it's like,
An intruded, extruded,
Okay.
where if the tooth is really traumatized, where it's, the root has kind of broken the bone. We see those sometimes. Fortunately for us, and I should knock on wood, this is pretty rare to have these dental emergencies. We see fractured teeth a lot. Mouth guards in sports are fantastic.
Okay.
The sports injuries that we see the most are actually in sports that you would not think that you would have injuries, because in football or hockey or some of those, they always have the mouth guard, right? Boxing, those type of things.
Yeah.
But in the summertime, a lot of the tooth trauma that we see is a kiddo getting out of the pool and
they
just
slip.
slipping and just breaking a tooth.
That's awful.
Or when I first started in dentistry, I thought, that's kind of rare. Every summer, we probably have 5 or 6 or 7 kids come in with like a broken tooth. And usually it's not a bad broken tooth, but getting out of a pool or even soccer and basketball, those type of sports where you're out on the
physical
field.
contact.
Yes.
Not enough that
but
they
you're
would
not
make
wearing
you wear
a
a mouth
guard.
guard.
Yeah.
that
So we
makes
see
sense.
some trauma from those as well.
How about like an impacted tooth? So same kind of like, instead of it popping out or moving forward, it just gets shoved up deep. What do you do about those?
Yeah, most of the time we get a baseline x-ray.
Okay.
And often we just kind of wait for those to re-erupt. A lot of times they'll just come down on their own.
The body will just push it back out?
Baby teeth do this a lot.
Okay.
They will continue to come down.
Okay.
Permanent teeth will do the same. They'll keep coming back into the mouth. Sometimes they'll get stuck. What happens is the bone actually fuses to the root at times, and then they might come in a little bit and then they'll kind of stop. But it is a waiting game on those. We just get an x-ray and then we kind of keep an eye on it.
Hey, thanks so much for listening and watching us chat about teeth.
Yeah.
I hope we covered some of the important topics that are meaningful to you, and maybe you got some good information to take away. Thank you so much, Dr.
You
Jenkins.
bet. Yeah, I appreciate you having me.